Welcome. I'm Leslie Canham.
I'm Mary Gavoni.
I'm Linda Harvey.
I'm Olivia Wan, and together we are the Compliance Divas.
Welcome to this episode of the Compliance Divas podcast. I'm Mary Gavoni, and I'll be your moderator for this episode. The Compliance Divas bring clarity and simplicity to compliance by navigating the regulatory world to keep you on course. You can subscribe to the Compliance Divas podcast through your favorite podcast channel or on our website, thecompliancedivas.com. Any resources we mentioned during this episode can be found on the Compliance Divas website, and you may submit any questions that you have to support@thecompliancedivas.com. So it's been a little busy out there in the infection prevention and control world. We've had a number of developments that have taken place over the past few weeks. And so what we wanted to do was give our listeners a brief summary of what is going on, what is happening currently, and what kind of precautions we may need to take in our practices. So just a week ago, we received a health alert notice from the Centers for Disease Control on dental unit water lines. There have been 2 more cases of children who have developed mycobacterium infections, non-tuberculosis mycobacterium infections. We don't know for sure, but probably Mycobacterium abscessus, which is what the microorganism that was involved in the cases that occurred in 2015 and 2016 in pediatric practices. We're dealing with RSV. We're dealing with still COVID-19. The pandemic is still not over. And there are some public health experts that believe that we could be in for, in the next several months, a tridemic of COVID, RSV, and flu or influenza all at the same time. So let's talk about what has happened recently and what we need to be concerned about in our dental practices. So first of all, if your practice is not subscribed to the Health Alert Network messages from the CDC, you should. It's a free subscription. We will have the link in our resources so that you would get any of these kinds of messages or alerts. And this one was pretty widely covered in the news about more cases of children who had pulpotomies that contracted infections as a result of contaminated dental unit water. So the CDC has a page under the tab of the Division of Oral Health within the CDC that talks all about dental unit water quality, the water standard, the protocols that we need to follow. So we will have that resource again on the show notes for the podcast and also on our website so that our listeners can go and take a look at that. But the really important thing that comes from all of this is that dental unit water lines need to be tested. And we just released an episode this week of our podcast on dental unit waterline testing. So we'd encourage you, if you haven't listened to that episode, to do that. Because the only way that you know in your practice that what you're doing in terms of shocking or cleaning your water lines is to test and see what the microbial levels are. So we encourage you to listen to this past week's podcast and to make sure that you have a testing protocol in your practice. So moving on from dental unit water lines, Olivia, can you talk to us about what is happening with COVID and the metrics for tracking COVID cases?
Sure, Mary. One of the things I wanted to point out, it seems like some people are letting their guard down when it comes to COVID-19. But when we look to CDC's information and we look at the country as a whole, using the graphic that CDC provides, it just lights up red and orange, which indicates substantial to high transmission risk. So it's very important for dental practices, or at least one person from the dental practice, to look up the COVID transmission risk week to week. And they can do that by going to the COVID tracker, which we'll have that website on the resource page. And the dental personnel member would simply type the state and the county, and then CDC will populate what the risk is. So, for example, in Tennessee, in my particular county, which is extremely rural, the risk right now is low. But that's not the case in some of these larger metropolitan regions or other states. So, Mary, I think it's really important that a dental team member looks this risk up week to week so that they can make sure they are wearing the appropriate personal protective equipment, because we understand if the risk is substantial to high, we should be wearing N95s for all aerosol generating procedures. So I think that's a good way to stay up to date. What are your thoughts, Mary?
Absolutely. That is the best thing to do. And just a reminder to our listeners that, as Olivia said, we're looking at the transmission risk or the community transmission levels, not the community levels, which simply talk about the prevalence of cases. We want to know how they're spreading from week to week. The other thing to keep in mind is that even if you're in an area where the transmission level appears to be low, or the community level appears to be low, we don't really know how accurate those numbers are right now, because so many people are doing COVID tests at home and not necessarily reporting them to the local health department. So we probably are underestimating the number of COVID cases, but they're still out there. So Leslie, take us to respiratory syncytial virus, and how is that affecting practices across the country?
Well, Mary, it seems that we hear on the news that it is affecting mostly younger children, but it can also affect older adults. And I think that our dental practices today are seeing many older adults. And what they're saying is that older adults, especially those over 65 years, are at risk. Adults with chronic heart or lung disease and adults with weakened immune systems. Now, at this moment in time, we have seen a huge increase in cases of RSV. If we take a look at the data that has been accumulated, they have a data on the CDC website. And I just want to go back for a moment. 2 years ago, in November of 2020, there were about 25 cases of RSV detected in the United States through PCR and antigen tests. A year later, in 2021, that jumped all the way up to over 5,000 cases. And most recently, our last tracking was on October 29th of 2022. So for our time frame here, just within 2 weeks, 13,759 cases of RSV. It's something that is quite frightening to parents of young children, because infants or premature infants and children under 2 years old can become severely affected. And according to the CDC fact sheet, which is very easily printed out from the CDC website, and we'll make that available on our resources page for the Compliance Divas website on this podcast. It states that each year in the United States, there's an estimated 58,000 to 80,000 children younger than 5 years old who are hospitalized for RSV. So to me, that's a great deal of fear that parents may have, and patients may ask questions. It's a really good idea to print out the fact sheets for whatever the circulating infection du jour is. And today we are hearing a lot, as we mentioned, we've got COVID, we've got RSV, which is on the news, I think, almost nightly. And we still want to keep track of what's happening with dental unit water, and then influenza. So I'd like to just give you an idea of what we're looking at with influenza. There's been a huge increase. Influenza is reported by week on the CDC website, where you can go to a tracker. And the current activity continues to increase. there was actually a second pediatric death as a result of the 2022-2023 flu season. And by the way, influenza season starts about October and goes through about May. So we're looking at now, this is the very beginning of our influenza season. And CDC estimates that so far there have been 1.6 million influenza illnesses with 13,000 hospitalizations and 730 deaths. Now, annual flu vaccine is still the best way to protect against flu, and CDC recommends that everyone from 6 months to and older get the flu vaccine annually. There's also help for those who become infected with influenza. They can take prescription flu antiviral drugs that can be used to treat illness, and it needs to be started as early as possible. I think in dentistry, we get a lot of exposure to different aerosol transmissible type of diseases. Influenza seems to circulate pretty quickly among us. And the rates of influenza, right now we're at what's considered to be week 43 of the year, of the 2022 year. And the increase over the last 3 or 4 weeks has just been tremendous in the number of cases.
Thank you, Leslie. That is great information. And I keep going back to something that Olivia said earlier about it's not time to let your guard down, and it's probably a time to be even more diligent. I've noticed in my area more people going back to wearing face masks because of these particular threats. The good news on influenza this year is that, according to reports, the viral strains in the flu vaccine are close matches to what is circulating. The bad news is that the rates of vaccination are down. We didn't have a lot of flu cases last year or so much the year before, but many of us were wearing face masks all the time. So that helped to prevent cases of influenza. The flu vaccines that are available this year are all quadrivalent. So they give 4 strains of the flu vaccine, protection for 4 strains. So they are better and more effective. We just have to get people out there to get their flu shots. And just one quick reminder, you cannot get the flu from the flu vaccine. It is not a live virus vaccine, and it takes about 2 weeks to develop antibodies once you get your flu shot. And so if you were already exposed to some type of respiratory virus and you happened to develop symptoms shortly after you got your flu vaccine, it didn't come from the flu vaccine. You most likely were already exposed. And I also have some really exciting news that we heard this week from Pfizer about an RSV vaccine. There has never been one. There has been one developed, and it's just finished its phase 3 trial. So it's ready to go then to the Food and Drug Administration to get approval. And the study was done in pregnant women to check for safety and efficacy, but also to see what the immunity levels were that were passed from the mother to the baby. And what they found in the study was no harm to the moms, no side effects reported, and 88% immune protection for the first 3 months of the baby's life. So they're projecting that perhaps next fall, this RSV vaccine will be available. So that is great, great news. Olivia, you had something that you wanted to share about influenza vaccines with us.
Mary, it seems like in looking at practices that have better compliance with the flu vaccine are those practices where a management or the dentist bring in companies like the shot nurse to vaccinate the employees that are willing to be vaccinated. This way, it's convenient, it's at their office, and it doesn't cost the employees anything. And this is really more common in other larger corporate settings where there are hundreds of employees. And so the company management prefers to bring a nurse on site to vaccinate, to encourage vaccination and try to offset the risk of people losing work and being behind on projects.
That is a great point, and it does make it very convenient. And there also are some states like Illinois where dentists are able to administer influenza vaccines. So that may be something that could even be offered to patients as well as to employees if the dentists are allowed to administer them. So, what we hope that our listeners gain from today's episode is a timely update as of November 10th of all the things that seem to be happening right now within the infection prevention and control arena. But I think Leslie would like one last word about monkeypox.
You know, Mary, monkeypox is something that we did a podcast on over the summer when there was really about 300 cases in the United States. And as of today, we're finding November 10th, again, 2022, 28,797 cases. Now, with that large number, what we hear the experts telling us is that the transmission rate is actually going down. But I want to point out for my California listeners that we're leading the pack in the highest number of cases. We have, as of today, 5,512 cases of monkeypox. And just next in line for the New York listeners, we have 4,132 cases. So remember, this is something that can be transmitted as contact transmission. So we need to be diligent with our disinfectants and be aware of the questions that our patients may ask us about monkeypox and whether they're safe in our care. We can certainly answer those questions appropriately by letting them know that we follow CDC guidelines for disinfection of all clinical contact surfaces and patient care areas with the appropriate products. We can also let them know that we're staying on top of what's happening with infectious disease transmission. As healthcare providers, we are responsible for their care while they're in our chair, and we're doing our very best to stay abreast of the changes. So with that, again, I encourage our listeners to stay closely connected to the information as it develops on the CDC website. Keep an ear out on the news for what your patients are hearing, because they will have questions. We want to listen carefully and respond appropriately.
Well said, Leslie. What we don't want is for our patients to catch us unaware of what they're hearing out there in the news. So we have to be able to answer their questions and address these issues credibly. So we thank you for joining us for this episode. We hope that you'll join us for future episodes as we continue to navigate the regulatory and infection prevention and control world to help keep you on course. Again, any resources that we mentioned during this episode will be available on the compliancedivas.com website and also in the show notes for the podcast. If you do have questions, please submit them by email to support@thecompliancedivas.com. See you next time.